Hi, thanks for joining me today. My name is Jeff Stark. This is the second video that is addressing this very difficult problem of marital unfaithfulness. For our purposes, we're talking about a husband who's committed adultery, the wife who is the victim of that, and the struggle that they have in trying to get through that successfully. One of the questions that's raised is, or thought about at least, is why does it take so long for a couple to work through this particular problem? And in answering that, I generally give my clients a metaphor to try to help them understand why it takes so long. I'm going to tell you the metaphor today, and I hope this will be helpful to you, as it also is helpful to my clients when they have a chance to hear it. It's helpful for the perpetrator, in this case the husband, and it's also helpful for the wife, who's the victim in this case. So here's the metaphor. If you cut your finger on a little piece of paper, you're going to get some blood, and you're going to be required to probably clean it and put some Band-Aid on it. And then by the end of the day, you'll take the Band-Aid off and it'll be good. And I just happened to do something like that this morning. I cut my finger. I don't know how. It was bleeding. I put a Band-Aid or two on it this morning, and by tonight, I'm sure I'm going to be able to take it off and I'll be good to go. Small problem, small injury, short period of time, over and done within 12 hours probably, if not sooner. However, there's a more serious injury, and that might be if you're in the kitchen and you're making dinner and you've got a knife and you're cutting up celery, zucchini, tomatoes, whatever, and you cut your finger and the knife goes in fairly deep. Well, now you have a more serious injury that's going to require a more serious treatment, and it's going to take a longer period of time to get better. You'll go to the hospital, they'll look at it, they'll clean it, they'll sew it up with a couple stitches at least. They'll put a stent around it and tell you, Mr. Stark, 3 weeks, take the stent off, stitches will dissolve, you're good to go. Put the stent back on when you take a shower, and try not to re-injure the problem. But one was a 12-hour problem, and this one is now maybe something that will heal in maybe 3 weeks. It's more serious injury, longer period of time. Okay, now what if I'm riding my bike and I had a pothole, not uncommon these days with potholes, and I go over my handlebars, which I've been known to do, and I break a leg. Well, more serious injury than the previous two. Go to the hospital and they're going to set the leg, put it in a cast, and the doctor's going to say, Mr. Stark, probably 12 weeks from now, you're going to be able to take the cast off, come back in, we'll take it off, a little bit of physical therapy, and then you'll be good to go. So a more serious injury and a longer period of time to recover. Okay. Now, let's say, for example, that you have a problem that requires surgery. Recently, I had to have surgery, and it was a very serious problem, a bone, a broken hip, and I had to go under surgery, anesthesiology. I had to be on crutches for an extended period of time. I had many weeks of physical therapy. But eventually there's a recovery, but a more serious injury requires a longer period of time to recover. Let's imagine that you're walking across the street. Maybe you're paying attention to your cell phone or something. But let's say you get hit by an 18-wheeler. Oh no, that's an awful, awful injury. And you've got multiple broken bones, you've got concussions, you've got stitches, and you're in the critical ICU unit, the critical care unit, for 3 or 4 or 5 weeks. You've got tubes running in and out, you're in and out of consciousness, and the attention that you're getting is 24/7 from a very intense medical facility. When you're done with that, assuming you survive, you're going to go upstairs into the hospital bed, and you'll probably be there for 1 week, 2 weeks, 3 weeks, 4 weeks. As you recover in that different environment, you're still a very, very fragile person, and you may have to have more surgeries as well. You may even be in the hospital for a longer period of time. If you get out of the hospital, if it goes well, well, then you're going to be in your bed at home for probably 2, 3, 4, 5 weeks. Eventually, you'll get out. You'll begin a very, very long process of healing and mending, learning how to walk again, how to be agile again, and going about your normal activities. But obviously, getting hit by a car or an 18-wheeler or something like that is far more severe than cutting your finger or maybe breaking a bone. What I tell a couple is this, is I turn to the husband in this case and I say to him, your wife has been hit by an 18-wheeler truck. This marital unfaithfulness is not a small problem. It's not a short problem. But it's a very, very serious problem that involves intensive care unit sort of mentality and treatment. And she's not going to get out of bed in a day. She's not going to get out of bed in a month. This is a very, very life-threatening situation, and it's going to take a long time to heal. Marital unfaithfulness is like being hit by an 18-wheel truck. It's very serious. It could be fatal to the marriage. And it's going to require a great deal of attention in the beginning. Sometimes it involves being in counseling 2 times a week, maybe 3 times a week for an extended period of time. And then if it's going well, it might be once a week, but it's going to take a long time. And it's going to require a lot of help on the part of multiple people. So that's what I try to say to the husband is, your wife has been hit by an 18-wheeler. And this is not a short recovery time. This is a long recovery time. And you cannot expect her to recover from being hit by an 18-wheeler and having multiple broken bones, multiple surgeries, concussions, and so forth and so on. You can't expect her to mend in 3 weeks with a cut finger and a couple stitches, or even a broken bone in 6 weeks and crutches. It's a very, very different situation. I tell the couple that because the husband oftentimes is in a hurry, husband in this case, is very much in a hurry to put this matter behind him. He's embarrassed, he's ashamed, he's guilty, he doesn't like talking about it, and he's willing to be patient, but it's not unusual for a husband, in this case, for his patience to run out and to get annoyed and angry that she isn't recovering more quickly. He might say to her, look, it's been 6 months. It's been 9 months. You're still talking about it. You're still bringing up what I did. Why? You told me you forgave me. Get over it. We're done talking about it. We're not going to talk about it any longer. That's not unusual at all to hear from a husband who's had an affair or a wife who's had an affair and is waiting and hoping and wanting their victim spouse to recover as quickly as possible, because it's very painful for him or her, having done what they did, seeing the consequences of what they've done, and having to live with those consequences for any longer than they need to. They're usually in a very, very big hurry to get over it as quickly as possible. And secondly, they oftentimes apply a great deal of pressure on the spouse to get over it and to forgive and move on much more quickly than it really reasonably amount of time it would take. Can couples recover from this? They can, but it's important for the husband to understand this is a major life and death situation. It's going to take a significant amount of time to recover. You have to be very patient. With the patience that God wants to give you, you're going to have to be extremely patient for a long period of time to give her the appropriate time, the suitable time to get over it. And husband, you're not the one to decide that. You're not the one to decide what is a reasonable period of time to recover when you've been hit by an 18-wheeler or marital unfaithfulness. This is very encouraging for the wife in this case to hear this metaphor as well, because she's struggling. In a good case scenario, she wants to get over it, In a bad case scenario, her husband's pressuring her to get over it and to forgive and to be done with it, and she's not able to do that. She's still upstairs in the hospital bed, and the husband's wanting to get her out of the bed and go about life normally as though nothing's happened. That can't happen. So it's also, this metaphor can be very, very helpful to the wife in this case to say, you know what, I understand now. Yeah, I've been hit by an 18-wheeler. I'm in the ICU unit. I'm recovering slowly. It's going to take a long time. And now I understand why, because it's not simply a cut on the finger. This is a potentially fatal situation for a marriage. And it's a crucially difficult, painful, and long-term process. You know what? I guess there's nothing wrong with me. Yeah, I feel like I've been hit with an 18-wheeler, and now I'm getting annoyed that my husband isn't willing to be patient with me for God to help me to get through this in a reasonable, suitable time frame. Can God help husbands to be patient like this? Yes, he can. And he wants to help the husbands in this case, not only to repent and to receive forgiveness, but to even supply him the patience and the endurance and the perseverance that is necessary for him to love his wife and to correct this matter, number one. But number two, can the gospel and can Christ help a woman who's been hit by an 18-wheeler and who is emotionally in a ICU unit and having to take a long time to recover? Can she recover? Can she mend? Can she heal? Can she forgive? Can she move past this by God's grace and through the gospel? Yes, the Lord wants to help her to do that as well. Lastly, I tell them this. This is going to be the most painful thing that you've probably ever gone through. The most difficult thing that you've possibly ever gone through. But if you turn to God in a very deep and profound way, God will help both of you in ways that you both need to be helped. And if you come out of this with God's help, I can pretty much guarantee you that you're going to come out of it a very different couple, a much stronger couple, and a much better couple, having gone through this experience, painful and difficult and hard as it is. They're usually very, very happy to hear that last part. Thanks for joining me today.